All right, so the next piece is personality disorders, okay? Now, personality disorders are on our axis 2 of the DSM, and they're separate from all of those axis 1 disorders that we've been talking about, okay? And the reason for that is that personality disorders are incredibly difficult to diagnose, and we still are trying to understand them. Now, and again, if you think back to when we talked about personality, well, there's so many different ways that personality is exhibited. How can you then define a personality that is disordered? Okay. Well, what they've done is they've called personality disorders enduring patterns of social and or behavior that impair social functioning. So basically, we talk about personality disorders in terms of impairment of social functioning. And there are three clusters of, or categories of personality disorders. Okay. There's the anxious cluster, which are avoidant personality disorder, where kind of ruled by fear of social rejection. Okay. The odd or eccentric, which is like schizoid personality disorder, flat affect, no social attachments, and then the dramatic, okay, which is histrionic, attention-seeking, narcissistic, self-centered, or antisocial, amoral. Okay, so these are the three clusters, categories within personality disorders: anxious, eccentric or odd, and dramatic. So make sure you can identify these three clusters. Now, within each of these clusters, there's multiple different types of personality disorders that we'll take an in-depth look at most of those in class. Right now, though, we're really going to focus in on antisocial personality disorder, or APD. Okay, antisocial personality disorders refers to acting impulsively or fearlessly without regard for others' needs or feelings. Okay, so the diagnostic criteria include a pattern of violating the rights of others since age 15, including three of the following: deceitfulness, disregard for the safety or self of others, aggressiveness, failure to conform to social norms, lack of remorse, impulsivity and failure to plan ahead, irritability, irresponsibility regarding jobs, family, and money. Okay, so again, at least three of these, and age 15 on, we need to be seeing kind of this pattern of behavior. Okay, and again, the pattern of behavior means, okay, that it's a continuous, not once in a while, not every now and then. It needs to be kind of a constant, it needs to be more often than not. Okay, so which kids may develop APD as adults? Well, about half of children with persistent antisocial behavior develop lifelong APD. So which kids are at risk? The psychological factors include those who in preschool were impulsive, uninhibited, unconcerned with social rewards, and low in anxiety, and those who endured child abuse and or inconsistent, unavailable caretaking. Now, are there biological risks? Okay, antisocial and unemotional biological relatives increase the risk. Okay, some associated genes have been identified. The risk factors include body-based fearlessness, lower levels of stress hormones, and low physiological arousal in stressful situations such as awaiting receiving a shock. Okay, fear conditioning is impaired. Okay, and reduced prefrontal cortex tissue leads to impulsivity as well. So we do know that there is a biological background or a biological risk factor to APD as an adult. Okay. Oh, and substance dependence is more likely. Now, does antisocial personality mean that you are going to become a criminal? Well, what we've found is that criminals are people who repeatedly commit crimes. People with antisocial, personality disorder, and there's a small number of them, but the majority of criminals do not have antisocial personality disorder, and the majority of people with antisocial personality disorder do not become criminals. Okay, now, many career criminals do show empathy and selflessness with family and friends, just not with strangers. And in APD, you're not going to see it in anybody. Okay, and many people with APD just don't commit crimes. In fact, recent research into kind of CEOs and some of the most powerful people in the world kind of point to the fact that perhaps they do have antisocial personality disorder. And we'll talk about this in class more in detail. Now, if antisocial personality disorder is not a full picture of most criminal activity, what can we say about people who commit a crime, especially violent crime? Okay, well, the biosocial roots of crime are birth complications and poverty combined to increase risk. Okay, so if we look at the purple line is childhood poverty, the orange is obstetrical complications, birth risk, birth complications, and then both poverty and obstetrical complications, we can see that the people that suffer from both of those tend to have the highest percentage of criminal offenders, be the criminal offenders. Okay, so what are the biosocial roots of crime? Well, in the brain. People who commit murder seem to have less tissue and activity in the part of the brain that suppresses impulses. Okay, so if we look at the normal brain versus the brain of a murderer, you can see that this part up here, which is our frontal lobe, okay, seems to have less activity. Other differences include less amygdala response when viewing violence and an overactive dopamine reward-seeking system. Now, okay, all right, so that kind of wraps up this, and we're going to spend some time in class talking about personality disorders and looking at some of the other personality disorders as well.